Joining us now is Seth and Ann Klaiman, who recently gave birth to a newborn son, Sebastian James. They're going to talk a little bit about their patient experience at Women and Infants. Seth and Ann, thank you so much for joining us.
Thank you for having us.
Thank you, Raina.
Tell me a little bit about toward the end of your pregnancy, Ann. I know you had Sebastian James February 28th, but your due date was late April, so he was early. Tell me a little bit about what was happening in your pregnancy.
Sure. So I'd say, it was a relatively smooth pregnancy. I really didn't have much morning sickness. And we were really originally supposed to deliver him at South County Hospital. And one night, my water broke in the middle of the night, and luckily I had a checkup with my OBGYN that morning, and then they confirmed that my water had broken, and I was transferred to Women and Infants via ambulance. So we really weren't sure if I was going to go into labor any minute. So they were really just monitoring me to see if I was going to go into labor. But after 24 hours and I didn't go into labor, and then 48 hours, they were pretty much just like, okay, let's try to keep this going and keep him in as long as possible. So that's how we ended up at Women and Infants in the Antenatal Care Unit.
So she was there for 23 days, which, everybody kept saying what a great job she was doing. And Ann said, I'm not doing anything, but she really did. It was, she was in the hospital for 23 days, and, she wasn't on bed rest, but was trying to do her best not to obviously give birth to Sebastian 28 weeks or, to be 11 to 12 weeks early. And she held on for 23 days, which all the healthcare professionals said that was really important. And they were wonderful. The fourth floor, the ACU the nurses there were unbelievable.
Yeah.
They really were awesome.
So that probably really helped you through this experience. And once you had Sebastian, he was in the NICU. Can you talk a little bit about that?
Sure. So when we didn't really have much to expect. When you think of the NICU, you imagine this big room and there are incubators everywhere and it's a lot of noise. But I was pleasantly surprised to learn that the NICU at Women and Infants is their individual room. So it's really a more individualized experience. It's not just one big room. So it was really comforting that we had our own room. It was actually right below the ACU unit where we were. So I was on the fourth floor, and the NICU was right below us. So it was really comforting to be able to go right from where I was recovering after a C-section, right downstairs to go see him every day. But it was incredible. The NICU is amazing.
You had to be quite nervous. This is a nerve-wracking experience. Tell me about how the staff at Women and Infants cared for you and how they allayed your fears and let you know that everything was going to be okay.
Oh, right from the beginning. Once I came to the ACU unit, I remember it was Dr. Esteban. I was feeling terrified, really, and guilty and all these things, and just asking, why did this happen? And he just told me right then and there, it doesn't matter how it happened. We don't know why it happened, but the important thing is you're here now and you're going to have the best care, and you are not in any better place. And it was at that moment that I really realized, okay, that's true. There's nothing, whatever happened in the past, how we got here doesn't matter. The important thing is I'm in the best place now. And from that point on, it was just everybody was so caring and really made me feel at home, which helps with, keeping him inside as long as we did.
And I'll point out just a couple of things if I can. I don't want to name names because everybody was phenomenal, especially the nurses. The nurses on both the fourth floor and the third floor were truly amazing, and they've actually become friends. But two doctors I'll just particularly mention, Dr. Burns, who actually is a resident, who unfortunately is going to be leaving Women and Infants next month. It was phenomenal. He was with Ann so much when she was on the fourth floor. And when Ann was rushed in for an emergency C-section, and she can talk about it better than I, but when she was rushed in there and she saw that Dr. Burns was the one that was going to be doing the surgery, she felt so much better. And when I came in a couple minutes later and I saw him, and I wasn't sure it was him because obviously he was, garbed up, everything was better. And it turned out that Dr. Burns was actually the employee of the month in February, and which was completely appropriate. And I've got to say, at 10 o'clock that night, when he literally had his jacket and bag on, ready to go home, he came to see Sebastian in the NICU. And we actually have a picture of Dr. Burns with Sebastian. Actually, Dr. Burns saw him before Ann did, which is just amazing. And then the other person I'd give a shout out was Dr. Chinsky from the NICU, who came when Ann was induced on that Friday. He spent over 2 hours with me going through everything. And I said, you must have a place. He goes, I have nowhere else to go but be here with you. And he went through everything. And he said, God forbid that there is an emergency C-section. This is what's going to happen. And around 7 o'clock on Friday night, when Dr. Lord said, no, we need to go to the emergency room now. And within 15 seconds, there were 15 people that rushed into because Dr. Chinsky had said, this is what's going to happen. And it happened exactly the way he did. So the two doctors and every one of those nurses, and again, I won't even mention them by name. They were phenomenal the entire time.
Tell me what either of you would say to a woman in a similar situation going in with a high-risk pregnancy like this. If Women and Infants is going to take care of them, what would you say to that woman?
I would say just what Dr. Esteban had told me that day. And I was in tears and telling him, because you feel so many emotions when, especially in a high-risk pregnancy, and you feel guilty, but there's nothing to feel guilty about. It's just you're being taken care of so well, and you are really in the best place. You're going to get the best care, the best attention. I mean, there's just no place you want to be if you do have a high-risk pregnancy, and I could attest to that.
And I'll say too that, you know, it's cliche to say there's no better place to be, but there's really no better place to be. Women and Infants, and I've always known this in my professional life, and people say that Women and Infants is truly one of the best hospitals in the country. Never thought that I'd experience. As Ann said, we thought we were going to South County and everything was easy. And all of a sudden we were there, and we were there for 64 days. And there was never a day that we were nervous. You know, everybody there, from the nurses to the doctors to the housekeepers to maintenance, every one of them were phenomenal. And you know, they would ask, we'd come in, how's Sebastian today? And they became our family, especially because of what was going on with the pandemic. Our families couldn't visit.
Right.
And so our families really became the staff at Women and Infants. And
True.
There was never a worry in our at all, ever. You know, they were so fantastic, and every wonderful thing that's said about Women and Infants is true. You know, and it's really about the people there that made it the great experience that we had. And we'll never forget them, and appreciate them forever for what they've done for us.
So I love the name Sebastian. Can you tell me where you came up with the name?
Sure. So it's kind of a funny story. We have been going back and forth on names for months. Send some names my way, I'd say no. And then one of the performers of Il Divo's first name is Sebastian. And we said, what about Sebastian James? So we had always decided James would be the middle name. It's kind of a family name. And Sebastian James just sounded so perfect. And that's how we got his name.
And I'll tell you, on James, it's both of Ann's grandfathers, and one of my grandfathers is James. So that was fit. But she said, we'll wait and see when he comes out to see if he looks like a Sebastian. Well, needless to say, when he came out, we weren't, under the, the opportunity that we thought it was going to be. So the nurses looked and they say, does he have a name? And so I looked at Ann, and she hadn't even seen him yet. And she goes, Sebastian James. And we just knew. And everybody we talked to loves his name, and he looks like a Sebastian now, I guess.
Yes, he does. Let's get a close-up of little Sebastian James. Let's see that face. Oh, he's so cute.
Say thank you, buddy. Today's his 10-week birthday, and his adjusted age would only be 8 days.
Yeah.
So it's amazing to think that he's been with us for 10 weeks, but he should have only been here for 8 days. And he's doing great. Went to the doctors today, and his pediatrician says he's doing great.
Seth and Ann Klaiman, thank you so much for joining us today and for telling us your beautiful story about your experience at Women and Infants Hospital. Everyone at Care New England is very happy for you, and congratulations.
Raina, thank you for letting
so
us tell the
much.
story. And the story really is about the amazing people at Women and Infants and the great care that they gave Sebastian. He would not be the wonderful young boy that he is without all of them. So please thank them, all of us.
Thank you.